What do minimal residual disease numbers mean? Imagine finishing treatment and feeling hopeful because tests show no visible leukemia cells. But beneath that, tiny traces of leukemia might still be hiding in your blood or bone marrow. These traces are called minimal residual disease, or MRD. MRD numbers tell us just how many leukemia cells remains after treatment, even when traditional tests say you are in remission. MRD is measured with very sensitive laboratory techniques that can detect one leukemia cell among 10,000 normal cells or even fewer. For example, an MRD level of 10 to the power of minus 4 means one leukemia cell is found among 10,000 normal cells. This level of detection is very precise and helps doctors understand how much disease is still present. If the MRD level is very low or undetectable, it suggests most leukemia cells have been eliminated. But if the MRD number is higher, it indicates more residual leukemia cells are still there. The importance of MRD numbers is mainly in predicting what might happen next. If MRD is detectable after treatment, it can mean that some leukemia cells survived and could cause the disease to come back in the future. Patients with higher MRD levels tend to have a higher risk of relapse. On the other hand, if MRD is not detectable, the chances of staying in remission are generally better, and the outlook for long-term survival improves. MRD measurement also helps doctors decide what to do next. If MRD remains positive, they might consider additional treatments to try to wipe out those remaining cells. If MRD is negative, they might opt for less aggressive therapy, reducing side effects while still maintaining good control of the disease. To measure MRD, labs often use advanced methods like multiparameter flow cytometry, which looks for abnormal cell markers, or genetic tests like polymerase chain reaction and next-generation sequencing, which identify specific genetic features of leukemia cells. These techniques are highly sensitive and provide detailed information about the disease status at a molecular level. In leukemia care, MRD numbers are a key part of staging and prognosis. They give a clearer picture of how thoroughly the leukemia has been treated and help predict the risk of relapse. Because MRD testing is complex and specialized, it's important for patients to discuss their results carefully with their healthcare team. This way, they can understand what their specific MRD levels mean for their individual treatment plan and future outlook. Remember, each person's situation is unique, and ongoing medical guidance is essential for making the best decisions.